Hi, my name is Seth King. I'm a physician assistant. I've been working at Western Kentucky Orthopaedics for the last 6 years. One of the common sports injuries that we can see in our practice is when somebody has an injury to their meniscus and sometimes even involving their ACL or their anterior cruciate ligament. Now they can occur isolated to where you have just a meniscus injury or just an ACL injury. But that would be one potential indication for doing a knee scope or knee arthroscopy. And the way that we go about diagnosing those problems is listening to the patient's history and gathering the information that they have surrounding their injury. And we do an appropriate physical exam, looking for specific indicators that would tip us off to that potential diagnosis. And then a lot of times we have to look at different imaging like x-rays and order an MRI scan to look and see if we have any injury associated with that. And once we've been able to identify whether patients have a meniscus or an ACL type injury, sometimes they can be treated conservatively with rest and anti-inflammatories, physical therapy and bracing. Sometimes they go on to require surgical intervention, which means going in minimally invasive with the knee scope and being able to go in. And sometimes we're able to repair the meniscus with some sutures. Sometimes we have to go in and just trim out that meniscus tissue. And with a meniscus injury, typically the recovery for a surgery like that is about 4 to 6 weeks. Patients are able to start weight bearing right away after a meniscus injury. It's an outpatient surgery, which is nice. You get to go home the same day. Stitches usually come out at 2 weeks. You see us in the office at 2 weeks. Therapy usually, we start pretty soon after surgery just to get you back rehabilitated as quickly as possible.